شكرا على المقدمة الجميلة حبيبتي. تشرفي دبي أي وقت طبعا. دكتورة سناء، حبت أتكلم على موضوع كتير مهم على الكوفيد childhood obesity what happened، وهل فعلا في مشكلة بالنسبة للobesity or not. So my talk is gonna be about COVID-19 and the childhood obesity and what happened. So this is the picture which we had at home, all of us. صح? Yes? You had a break, right? Are you awake? Yes? Yeah, okay. So this is the picture. مين ما عندوش البيكتشر هاي في البيت during Corona? So does it affect that we have obesity? Yes. So let's see whether it's true ولا it's Wafaa imagination and Dr. Sana thoughts about this. Let's see. A study has been done about the childhood obesity in US, accelerating the pandemic, and it was in New York. It just have been published in 16 September 2021. And it shows that the childhood obesity have been increasing. Of course, we know that it have been increasing in decades, and we saw Dr. Fatin and Dr. Jihan have shown in Egypt how much obesity is going up in all the country. The results of this show that by Dr. Alison Goodman, and he's from the Center of Disease and Control, that the pandemic appeared to be actually worsen the obesity. And they considered obesity as a pandemic as well. So we have two pandemics, the obesity and the COVID-19. What are the results? An estimation of 22% of the children and teens were obese last August, up to 19% earlier. Before the pandemic, the children who were healthy weight, they were healthy. They have gained weight actually around 3.4 pounds a year. Imagine, and 2 years, that means they doubled. And that rose up to 5.4 pounds during the pandemic. So it worsened the children who are healthy. What about the obese? It makes them even worse. The kids who were moderately obese, they have exceeded their weight up to 6.5 pounds a year before the pandemic, and 12 pounds, imagine, during the pandemic. And those are results. A severe obese kids, expected annual weight gain went up to what? 8.8 pounds to 14.6 pounds. Imagine, it doubled again. So it becomes even worse. The research was based on what? On a review of a medical record. They took the children, they took 432,000 kids throughout USA, that they are teens from age 2 to 19, who were weighted, of course, twice before the pandemic. So they have an accurate record about their weight. And some limitations were only included for who got care before and during the research of pandemic. And they said that CDC said that the number of states, at least 35% have increased. So we have a problem with obesity. So the obesity pandemic, look at that. We have almost half, 49% of the adults overweight and obese. During pandemic, they increased. Over the quarter, the adolescent, 26% of adolescents are overweight or obese, and 6% who are under 5 years old become obese during the pandemic. So it has a big impact and a big results. And of course, we all know with obesity, and not only obesity and pandemic, what we have, complications, all the complications, diabetics, and all the problems that we have with obesity. Now, the highlights were that children with obesity, they faced an increased biophysiological risk during COVID, and that was proven. Stress also have in fact affected the inflammation as well as in obesity and COVID-19. And the COVID-19 pandemic has significantly interrupted the children daily routine. And we saw the first picture. They were sitting at home, the food in front of them, they are studying and eating. So that's why they resulted that they have a big number of obese. And if, of course, it affected their health. The obesity and COVID, they are both pandemic. That they have a negative impact on our health and our children's health and the well-being of the children. And that was in the United States, which they have raised an issue about the severe obesity. The COVID-19 is highly contagious disease to human, and we saw what it caused. God bless Dr. Yasmin as an adult and Dr. Ihab, who were not here. And we saw so many children in our practice daily have been affected with the COVID-19, whether they become obese, they become malnourished. What are the risks of obesity? We all know them. Complications of obesity affect the cardiovascular disease, affect our health in all ways, and the weight stigma as well, and COVID complications, which might lead sometimes to death. So we have to do some preventing and some treatment. Children with obesity, they may experience a more severe COVID tragedy, including the need of respiratory support, and the response to COVID-19 pandemic evocated the major lifestyle changes, including what? Including staying at home. Now, recently, some of them have been back to school, but still recent, the schools were closed and they were staying at home, offer them food and sometimes bribing them just to sit in front of the computer and listen to the teacher. They bribe the children by chocolates, by candies. Please listen to what the teacher is saying. And this is one of the main reasons of having obesity as well. Look at this. Obesity, we have all the comorbidities which we all know, like dyslipidemia, renal problems, fat problems, sleeping disorders, all of that, which increase the susceptibility and severity when we have COVID. And COVID goes where we have stay at home, that leads to stress as well as so many problems with sedentary lifestyle. They don't move, they sit on the laptop for like let's say 5 hours, 6 hours, and after that they go and play with the indoor computers and their games. They stay for even more hours. So instead of staying 2 hours in front of the laptop, the whole day they are on the laptop and maybe half an hour just moving, just maybe to go to the toilet or asking for some help. So it's a big problem that shows that COVID and obesity are linked together. There was a mechanistic changes. We have a metabolic dysfunction problems, the insulin resistance increased, jumped up, the leptin jumped up, as well as we have so many problems in immune impairment, in adipose inflammation. Both of them have affected what? The physical as well as the comorbidities, which all leads to that maybe they can be ended up in the ICU. Or mortality have been increased, and we have seen this in so many places. So obesity, it's a major factor in COVID complications and might lead to death. And there was a global, in 2020, Global Obesity Forum, which have shown the roots approach. They developed the roots approach, which set up the integrated and comprehensive person-centered approach for addressing the obesity. They build up this root approach that in the global summit, recognizing the obesity problem and the obesity disease, especially during what? During COVID. And they did what? They did an obesity monitoring, where we have a surveillance and enhance of the strength effective the strategies of preventing and treating obesity. They have obesity preventing. They have treatment of obesity, which included in this root approach, and they did a system-based approach, which should be applied in treatment and preventing of obesity. So obesity related in children, it has so many effects. It affects them socially, where they have food insecurity. They have parental factors. Their parents, they just cook anything at home. And some of the women who didn't know how to cook during Corona, they become excellent chefs. And they start doing cakes and cookies and whatever you like for the husband and for the children. And all the family become obese. And this is a fact. So what happened? They become a good cook. Lucky for the husband, unlucky the children who become very obese. So it affects them negatively, though she become a very good chef. As well, anxiety, psychologically, mental distress, sleeping, the sleeping have been, you will be surprised that the sleeping have been affected. They don't sleep because they don't have school tomorrow. So what they will do, they will stay all night playing games and in the morning sleeping in front of the laptop in the school. And the teacher, poor teacher, she's shouting and screaming and he's sleeping and the mother is bribing them to wake up. I'll give you chocolate, I'll give you burgers, I'll give you cakes to let the children woke up, which have been affecting again negatively. Now, there is a big relation between the two pandemic, as we have just shown. Obesity and COVID, they interact together, and it have shown that obesity have a risk of increased severity during COVID. Excess weight had happened during the pandemic, and the decrease in the immune response have been shown. And all this, as you have seen the link, it is there for you, dear doctors, to go back and just read about them. It is there with the facts, the effect of pandemic on overweight and obesity and decreasing the immunity. Their immunity have become low. They become fragile. All of them, whether the adults, even the children. So during the COVID, it have been a prolonged closure with compulsory to reduce we want to reduce the infection. So we let them sit at home. This disturbed routine for the children, they decrease their physical activities. So no more physical activities, even at school, which have been door. There's no physical activities even outdoors. No gardens, no playgrounds, nothing. It's all in that room. So what they will do, they play games. Reduction in energy expenditure was tremendously shown. The defect, it have been reduced in their weight reduction and their calorie expenses. And what happened? They have just eaten more food with the calorie out just less. Excessive screen time, and that's what I have said. They have been in the screen the whole day, just snacking and eating. And that's what caused the obesity and overweight to become a problem. Children who rely on school-based health and mental care, children from insecure families, obese children, all have been affected even more negatively, and it have been worsened the problem during the COVID. The children, they used to eat an additional calories each meal, lunch, breakfast, dinner, even the snacks in between, it have been doubled during the pandemic. They don't have anything to do. And as I said, the mothers, they have been started to be, even the parent, the father, who never maybe entered the kitchen. I have seen some men have become good chefs at home, helping their mothers, their wives, to cook for the children because he doesn't have anything to do. Instead of fighting with his wife, he better cook. So he starts becoming a chef as well. That's what caused, again, a problem, which have sugary drinks high, junk foods high, amounts of vegetables and fruits. Poor this group. They were suffering. Nobody touched them. They don't care about them. So we have micronutrient deficiencies. We had iron deficiency. We have vitamins deficiency because they don't eat fruits and vegetables. They increase to have starchy food and sugary food. food insecurity, as I said, and there is an interaction between the insecurity and malnutrition and obesity. What do I mean by food insecurity? They don't have the healthy food secured at home. What they have is high starchy, high sugary, high calorie food. Family with a limited purchasing as well, they didn't go out to buy that because it's in Corona, most of the time there was a lockdown in so many places. And as I said, this study was in US. Canada, till now, they have a lockdown. So this prolonged long time, for 2 years, lockdown have increased the access to a healthy food. Closure of school, as I said, and about 1/3 of the families preferred to buy high-calorie food, snacks, sweets. Why? Because their children like it. And that caused an increase of 47% of the consumption of canned food and pre-packed food, which have increased, which they are high in calories and in sugar. So the efforts to reduce, the families and with the children have to face the virtual schooling, limited activities. So we have to work on that. We have to make sure that include this disturbed family routine by increasing the awareness and doing more physical activities. We have a new approach which we could do in this for virtual. We have a good physical exercises which have been now done to help those children to be more active even if they are at home beside the screen. This pandemic have caused them to create more walking and biking even at home. Environmental determined dietary habits, pediatricians, they are the main, you are, dear pediatricians, the main goal players in this to help the parents to understand how to eat healthy and how to be physically fit. In conclusion, the evidence is clear that there is a very big relation between childhood obesity and COVID. There's a clashing between the two diseases. And there is also, it have shown that the bioecological environment have placed children and adolescents for the increase of the risk of obesity. And there's a once familiar environment for the family, home, school, community, and multifactorial interaction that have been changed, which we have to play in controlling it. The impact of stress have been done a tremendous job. So we have to work on that to look into the economic and the social outcomes. The healthcare providers have to play a very important role to reduce the negative impact of COVID on obesity. School closure, we have again, as I said, we have to work on increasing the education for balanced diet as well as physical activities. We have to make sure that, like for example, many countries such as China, USA have already reported an increase of obesity and putting a plan of preventing in case of pandemic, which we didn't look. Nobody expected that we will have in 2019 a pandemic in our generation. We had it very earlier. Who expected to have a pandemic? That's why they start putting policies, they start putting procedures, they start putting guidelines to control this pandemic in case, la qadar Allah, in the future we have something to come. These are my references, and I thank you very much, and Dr. Sana as well for this talk. Thank you.